men with prostate cancer, getting rid of the cancer is obviously the top concern. But the fear of becoming incontinent often weighs heavily on a man's mind. Male urinary incontinence is usually caused by a damaged urinary sphincter, the circular muscle that controls the flow of urine out of the bladder. When damaged, as may occur during prostate cancer surgery, the muscle cannot squeeze and close off the urethra. This causes urine to leak. The incontinence rate following prostate cancer surgery ranges from 1 to 31%. Many men suffer in silence, thankful that they survived cancer, but they choose to restrict their activities and change their lifestyles out of a fear of embarrassment from odor, from wetness, or the discomfort of disposable pads. Feelings of isolation, anger, and depression are common. But it doesn't have to be that way.
In dealing with incontinence, I had to change my lifestyle. I changed my wardrobe. I wore only dark pants because if I had an accident, I didn't want anybody to know.
I didn't even want to golf anymore. I'd go golf with my buddies and I was afraid that if I'd swing that club, I'd leak a little bit. I didn't play with my grandchildren like I normally would.
The most common type of incontinence following prostate cancer surgery is called stress urinary incontinence, or SUI. When the urinary muscle or nerves are damaged but still have some function, SUI happens when you leak urine during activities such as sneezing or coughing, or other exercises like bending, lifting, swinging a golf club, or jogging. In cases where the urinary sphincter muscle is completely non-functional, the result is continuous leakage of urine with no control. While every man's situation is different, many find they regain continence within 6 months to even a year after prostate cancer surgery. If the symptoms persist beyond that time, you should discuss your situation with your doctor. The good news is that there are more treatment options than ever before, and nearly every man can be helped to restore bladder control. There are a number of ways to deal with incontinence, ranging from ongoing management to permanent surgical solutions.
I tried the biofeedback, finally resorted to a Cunningham clamp, but I was not just leaking, I was draining. I was using more than 15 pads a day and 1 or 2 diapers a day.
To deal with my serious incontinence, I tried many different things. I tried a condom catheter, that didn't work. I tried having regular pads, that didn't work. And I tried a clamp, a penile clamp. And the penile clamp is extremely frustrating because certain times it works very well, but sometimes it really hurt.
Surgical options include a male sling designed to support the muscles surrounding the urethra and an artificial urinary sphincter which mimics the function of a normal, healthy sphincter. Let's talk a little bit more about these treatments, which can provide a permanent solution to the problem of incontinence. For men with mild to moderate stress urinary incontinence, those wearing less than 3 pads per day, the Advanced Male Sling System may be the most appropriate treatment. The demonstrated results of this surgical therapy have made the Advance the market-leading surgical solution for mild to moderate stress incontinence.
I talked to my urologist about what steps I could take to eliminate this problem, and there was a few that he mentioned, and I decided to go with the Advance sling.
The sling supports the urethra, restoring normal bladder control. There's nothing to operate, and it's completely inside the body. The Advance Male Sling is a minimally invasive outpatient procedure that can be carried out under spinal or general anesthesia. During the procedure, a small sling made of synthetic mesh is placed inside the body through a small incision. Many patients are continent immediately following the procedure and can resume normal, non-strenuous activities shortly afterwards. The Advance is not for everyone. Treatment results may vary depending on your own medical condition. Talk to your doctor to discuss the risks and benefits of this device and your treatment options. The Advance is only available from your doctor.
I did, and the best thing I've done. So I've got my life back. It's great because a lot of times before I had the advanced male sling, my youngest son would sit on my lap and he would just hit that right place and it would be like, okay, here, I gotta run to the restroom. And that, that was very disturbing and trying and frustrating and depressing that I couldn't do any of that, and now I can. Now I can do it all.
Life is as good probably as it was 25 years ago.
Since Gary's had his surgery, he feels like he's gotten his manhood back. I got my husband back full, and we're both very happy.
I haven't had have to wear a pad since. It's great. I feel like like a new man, and my friends and family can tell. They've shared that. They've said you carry yourself in a more positive way, and they can tell I'm happy.
For more severe incontinence, or those whose symptoms are not treatable by other methods, your doctor may recommend a device known as the AMS 800 artificial urinary sphincter to provide simple, discreet urinary control. Since 1972, this has been the gold standard worldwide for treating severe incontinence. It effectively gives most men the ability to achieve continence, and published clinical data shows long-term effective results. Patient studies have shown that 90% report satisfaction with the AMS 800, and 92% would have the system placed again.
I heard about the artificial sphincter from talking to my doctor, and I was telling him about the pads and so forth, and I also use the external catheter and everything, and I was getting tired of it, and he told me, well, the artificial sphincter would help cure some of those problems.
And then finally, what the doctor referred to as the gold standard, he said this is the AMS 800, and it's the sphincter, it's an artificial sphincter muscle, and he showed how that worked.
Placed completely inside the body, the artificial urinary sphincter mimics the healthy sphincter, keeping the urethra closed until you want to urinate. The device consists of a connected system of a pump implanted in the scrotum, an inflatable cuff surrounding the urethra, and a balloon reservoir implanted in the abdomen. You control urination by squeezing and releasing the pump, which moves fluid out of the cuff, which is compressing the urethra, and back into the reservoir. Because the empty cuff is no longer closing the urethra, urine can flow out of the bladder. After you've emptied your bladder, the fluid automatically returns from the reservoir to the cuff, squeezing the urethra closed again. The AMS 800 typically requires about an hour of surgery and can be performed on an outpatient basis or with a 23-hour hospital stay. The AMS 800 is not for everyone. Treatment results may vary depending on your own medical condition. Talk to your doctor to discuss the risks and benefits of this device and your own treatment options. The AMS 800 is only available from your doctor.
If I knew now, 5 years ago, I would have done it then.
I remember going to get it activated after 6 weeks, and it was amazing. I had no leakage, absolutely none. So it was just wonderful. The artificial sphincter has changed my life dramatically. I could put the diapers away and never have to use them again. It was just great.
Joy, elation, excitement, that as if someone had given me a new start in life. And it was goodbye pads, goodbye diapers, goodbye plastic. I'm back.
In summary, stress urinary incontinence is a common problem, but nearly every man can be successfully treated. The Advanced Male Sling System and the AMS 800 urinary control system may be the dependable, long-term solution that you've been looking for to help you regain your control and confidence and restore your quality of life.
You do not have to live like this. You don't have to live with incontinence. There are options out there for you. So do it.